Hello, everybody. Welcome back to the show, Science Dispatch Podcast. My name is Cameron English, your host as always, joined again by Dr. Chuck Dinnerstein, Director of Medicine at the American Council on Science and Health. Chuck, what's going on? How are you today?
I'm fantastic. I'm really excited about our guest today.
Well, we've got a great guest. It's one of the godfathers of science communication, science outreach, whatever you want to call it. Pediatric infectious disease specialist, vaccine developer. 13 books now you've authored, I want to say, and now you have your own Substack, which is super cool. Of course, I'm talking about Dr. Paul Offit from the Children's Hospital of Philadelphia. Paul, how are you today?
I'm doing well. How are you? So when you say Godfather, what do you mean is old? Got it. I'm with you.
It's like more like a mafia don. It's respect. But and I mean that sincerely. I mean, you've been writing about vaccine safety and efficacy and the anti-vaccine movement for a long time, and I know a lot of people benefited. So Godfather with the utmost respect. But we're here to talk about your new book. Just came out at the end of February. It's called "Tell Me When It's Over: An Insider's Guide to Deciphering COVID Myths and Navigating Our Post-Pandemic World." So I know Chuck and I both have some specific questions for you, but before that, just give us an elevator pitch about the book. Why'd you write it? Why do people need to read it, and so forth?
Well, so I was on the NIH active group, asked by Francis Collins, head of the NIH, to be part of that public-private partnership with sort of academic researchers and pharmaceutical companies to advise on how to best test and the vaccines and antivirals. And I'm on the FDA's Vaccine Advisory Committee. So I kind of had a front row seat to this. And here's what I saw. On the one hand, here's a virus that raised its head in the western section of the Hunan seafood market in an animal-to-human spillover event in late 2019. You isolate the virus, you sequence it. 11 months later, using a technology we'd never used before, messenger RNA, we made a vaccine that was safe and effective. Then over 7 months, we inoculated 70% of the U.S. population. It was our ticket out of the pandemic. Nonetheless, at least 30% of the United States population simply refused to get the vaccine. And I guess the reason I wrote this book was why. I mean, what did we do right and what did we do wrong in this pandemic to either confuse people or alienate people?
So that stuck out to me about the book. My Kindle says I'm about 57% of the way through, so I'm almost done with it. But I noticed a theme throughout it, and I've seen it in previous interviews with you. So when I talked with you at the end of 2019, you're one of the first people that said, you know, these measures we're taking are probably necessary, but there's going to be some consequences from them. And then in 2021, when we talked, you said, at the time at least, someone who's infected probably doesn't need the vaccine that's available right now. And then throughout the book, you talk about, the need or the lack of need to give children a booster dose. And I know that caused some controversy for you. And so I found that fascinating, that everything you say is always science-based and you're always tentative if you're uncertain about something, but you were willing to divert from, I guess, the consensus or whatever you want to call it, like whatever the official public health response was. If you saw something wrong with it, you said, I think this is wrong. So talk about that, because that shows up in the book a lot.
Yeah, no, it's interesting. I'm a virologist. I studied rotavirus, and when you do that, when you study a virus, and then you go to places like double-stranded RNA meetings, which is a safe place, by the way, and you present your data, and you draw a conclusion, that these two proteins evoke neutralizing antibodies. You're criticized if there's a question about whether or not you could reasonably draw those conclusions. That's the way scientific meetings work. That's the way you want them to work. You want to make sure you're doing the right control so you can draw certain conclusions. So you need that back and forth. That doesn't work well in a public health arena. I think if you challenge in any way the science behind a policy, even if you think that science is thin or wrong, you're hammered for it. I mean, I managed to alienate the few remaining friends I thought I had left in this world, in the world of public health. It's probably no more evidently than in the bivalent vaccine story. I mean, not a bad idea. Omicron had come into this country. Why still use the Wuhan 1 strain or ancestral strain? Why not at least include an Omicron variant, which we did, the BA4, BA5 variant, and then partner it with the Wuhan 1, half dose of one, half dose of the other. It wasn't a bad idea. It just wasn't any better than what we had. I mean, the immunological studies showed that. 3 clinical studies showed that. I wrote a perspective piece in the New England Journal of Medicine basically saying that was published at the same time as two studies, one out of Harvard, one out of Columbia, that showed that it was no better than what we had. It wasn't worse. Boosters boosted, but it wasn't better. Nonetheless, we kept saying it was better. Major public health representatives kept saying it was better. And I called every one of them and I said, just stop saying it's better because it's not better. And for me, that was an example of politics trumping science. I mean, I wasn't surprised when politics trumped science during the Trump administration, with, say, hydroxychloroquine being probably the best example. But I thought when the Biden administration came in with the mantra of follow the science that we would, but we didn't a couple times. The other example would be in August of 2021 when President Biden stood up in front of the country and said, as of the week of September 20th, we are going to have a third dose of vaccine for everybody over 12. Where did that come from? I mean, at that point, before Omicron had come into the country, you still had excellent protection against serious disease with 2 doses. And so we had an emergency meeting, the FDA Vaccine Advisory Committee, and basically said no to that, as did the CDC Advisory Committee. So that kind of tension, I think, confused people. Here, the president's saying we're going to have a third dose, and here these advisory committees are saying no. So what does it take to be fully protected? Where are we? And I think we lost some trust in all that.
Let's back up a little bit, I guess a lot of bit, now that I think about it. But the book talks a lot about the impact of anti-vaccine activism. Of course, our dear friend RFK Jr. has been very active in some of the silly claims he's making, and he's not alone. Alex Jones, all of these figures. But you point out pretty early on in the book that it was back in the early 80s when the anti-vaccine movement started to gain traction culturally. And a lot of it came from the media putting them on TV and putting them in magazines. And of course, The Lancet published the infamous study on the MMR vaccine. So talk about that, because this is something that's come up for us in some of the articles we've written, is that the press at different times, although they say, misinformation is harmful, we need to stop it, et cetera, they would give airtime to things that are just blatantly false or at least misleading. So we saw things about breakthrough infections. I know you've been frustrated with that too, but throughout the decades, they push this stuff into the mainstream and then they turn around and they go, wow, there's disinformation everywhere. So what are your thoughts on that?
Yeah, I want to say one thing positive so I don't just come off as incredibly negative. I do think that creating the mRNA vaccines and distributing it to 70% of the public in that year and a half period was the greatest scientific or medical accomplishment in my lifetime. That was amazing, right? Novel technology, novel virus, incredibly safe and effective. I kept waiting for the other shoe to drop on the mRNA vaccines, and really other than myocarditis, it didn't. So that was remarkable, which makes it all the more remarkable that I think 30% of the U.S. public rejected it. But in terms of disinformation and misinformation, I think it's worse than it's ever been, actually. I've been following this story for 25 years, and I think that, especially on the right, there's been an embracing of this sort of anti-science thing. You have Marjorie Taylor Greene, hosting, Robert Malone or Kimberly Biss or others, in front of a congressional hearing who just say things that are patently false about vaccines. And it's just been hard to watch. I think science at some level is losing its place as a source of truth. It's becoming just another voice in the room, just an opinion.
Dr. Offit, let me ask you a slightly different question about that. In looking back at the public history of vaccinations, I'm the old one of the group, so I remember going into school to get my polio shot in the auditorium, when I was in second grade. And what I'm wondering is whether that historic experience that I think that a large part of the population lived through didn't in fact somehow taint our thoughts about COVID and vaccination. More specifically, polio and measles, those were the new vaccines coming out when I was a kid, are one and done kinds of vaccines. You're not going back for boosters, you're not going back annually. So that's a difference. The other important difference, I think, was that my parents were all part of that World War II generation and had been raised in the idea of teamwork and that the government knew best and that we all just jumped in and did. And I'm wondering whether that really had a much bigger impact from a sociologic point of view on how we address these public health concerns than we actually recognized until COVID.
First of all, I completely agree. I mean, my father fought in World War II. If you look at that, so for example, the polio vaccine had a problem. I mean, when it was released in April of 1955, 5 companies stepped forward to make it. One of them made it badly. I mean, Cutter Laboratories failed to fully inactivate polio virus. 120,000 children were inadvertently inoculated with live, fully virulent polio virus. I mean, there were roughly 40,000 cases of abortive polio, 164 people were permanently paralyzed, and 10 died. It was probably one of the worst biological disasters in this country's history, but it didn't cause the American public to lose faith. There's this film called The Polio Crusade by Sarah Colt Productions out of Boston. But if you watch that film, which is tape from people in the 1950s who suffered polio, what you got was a sense, exactly the sense you're describing, which is this notion of this shared national tragedy. And maybe it was because we were just coming off the shared national tragedy of World War II. We saw polio as a shared national tragedy. And so it pulled us all together. And you see moments like that now. I mean, I think when 9/11 happened, I think we all pulled together for a moment. And then things became divisive again. But I think it's a much more cynical, much more litigious, much more divisive time than it is now than it was then. We're much quicker to see conspiracy. You have, Congress people who are elected to Congress who use the term deep state seriously. So what do you do? It's a different time.
I hear you. In following up a little bit more on the deep state, part of the question, well, I was raised as a surgeon, so I'm raised in the idea that you have to go every week or so to confess your surgical sins, and you're forgiven, but you remember them. But it doesn't seem to be any way that we've really found to hold the public health system accountable. In a sense that it's too, like the banks in 2008 that were too big to fail. Our public health system doesn't seem to have any way to be accountable. I'm not talking about mass firings or anything like that, but you don't see them stepping up and saying, we made some mistakes along the way, and we did the best we could with what we had. We have a lot of fights at work about intentionality. Everybody seems to have this conspiratorial tone about what was going on, which I tend to think that it's more that people did the best they could with incomplete information.
I couldn't agree more. I'm of the belief that if you do that, if you step forward and you say, as we did with the bivalent vaccine, just say, look, it was a good idea at the time. It was no worse than what we had, but as it turns out, it wasn't better. So we're not going to do the bivalent vaccine anymore. We're just going to have a full dose of whatever is the predominant circulating strain from now on. We learned. We didn't pay much of a price because boosters still boosted. It just wasn't any better than what we had. I think that engenders more trust, but that's not the predominant feeling. I think the predominant feeling is that things are so divisive that if you express any kind of doubt, the people are just going to see, you can't trust anything that they say. But you're right. I think if you ask people, do you think we're going to know more about science or medicine 50 years from now than we know now? I think everyone would say yes. But when it comes to their disease, or in this case, our pandemic, people want to believe you know everything you need to know, when that's never true. When we sat on the FDA Vaccine Advisory Committee in December of 2020 and reviewed 300 pages of Pfizer's vaccine and 300 pages of Moderna's vaccine, I mean, you had a lot of data on 2 large trials, 40,000 person trial, 30,000 person trial. But still, that was tens of thousands of people for a vaccine you were about to recommend or authorize for hundreds of millions of people. You knew the other shoe was going to drop. And I just was right then. We said there are systems in place to pick up a problem if it happens, and it may well happen. But know that we're looking. And I just wish we'd expressed that. Also, the other thing was, this is a short incubation period, mucosal infection. The hope would be that protection against severe disease would last, and it did, I think, certainly through that first year before Omicron. And even with Omicron, you're still relatively protected against severe disease. But protection against mild disease was not going to hold up, as is true for every other short incubation period mucosal infection. Say that on day one, because what happened was by using the term breakthrough 6 months later, people were saying, they're worse. They're making us get this vaccine. We're mandated to get this vaccine, and still I have this infection. which caused me to, have fever for a couple of days and cough and sneeze. The CDC lied to me. And it's okay to anticipate. I think we should talk more. I'll give you an example. In 2009, we had the swine flu pandemic, and Richard Besser was the head of the CDC at the time. And if you go back to that time, he was in front of the media all the time. Every other day, every third day, he was in front of the media saying, here's where we are with this vaccine. Here's where we are with this disease. So I saw him at a recent meeting at the National Foundation for Infectious Diseases and said that to him. You were great. He said, thank you very much. I could never do it today. 2 reasons, politics and social media.
On the social media, it seems to me that runs on the gist of things, and that a lot of public health measures run on nuance, so that right away there's going to be a breakdown in communication. Even if they're communicating on all channels, communication requires a receptive audience at the other end.
Right. You do the best you can. I do think that so for example, when I'm in Florida right now, but there is a state surgeon general named Joseph Ladapo who put out this false notion that the messenger RNA vaccine contains fragments of DNA that can insert themselves into your DNA and cause cancer, which is biologically ridiculous. And so what do? I think what you do is you get out there on day one and explain to the public why that is biologically impossible, and keep explaining and create animations and graphs and put them out there. I mean, we tried at our Vaccine Education Center, and I was on CNN briefly with Breonna Keeler trying to explain this, but just keep putting it out there, because what the FDA did, and I'm not blaming them, but what they did was what we typically do in public health is they said vaccines are tested for safety, we have rigorous controls, which is another way of saying trust us. And there's a lack of trust these days. So just trust the American public that at least at the 8th grade level, which is to say newspaper level, you can explain fairly sophisticated scientific concepts clearly. I mean, every vaccine, measles, mumps, German measles, rotavirus, varicella, they all contain DNA fragments. They're all made in cells. I mean, assuming you live on this planet, which is true of, I know both of you guys, and assuming you eat, anything made from animals or plants on this planet, you're ingesting foreign DNA all the time, much of which ends up in your circulation. That's okay, because we have ways of handling it so that it never gets into our nucleus. And explain that. But I think we're shy about doing that. I'm not sure why. We have this kind of bunker mentality in some ways about this stuff.
If I can, I want to bring up a story from out here in California related to the science communication angle. So we had our governor propose a vaccine mandate and then implement one for state employees. And it came out in the local media that he had sided with one of the political groups that supported him in his re-election campaign against a mandate, and it was the prison guard union. They didn't want to force their members to be vaccinated, and when he went into court to offer support, the California Department of Public Health said, well, if the inmates are concerned, the best thing they can do is get vaccinated. So publicly, what he was telling parents and their children was, this is how we end this pandemic. Everybody gets vaccinated, and if you don't like it, then you stay home. And the merits of that argument we can consider independently, but it was extremely frustrating to me to try to make a case for vaccination when you have people like that doing something that's obviously political, And so on the other side, you had Ladapo, like you're saying, who said some really strange things about, the spiritual aspects of medicine. But then on the other hand, you have people like Newsom doing that. And I'm wondering, what impact does that have? I don't know if you know that story. It didn't get much coverage, which was quite frustrating to me. But what, just generally, the political aspect, how does that affect the ability of someone like yourself or Tony Fauci to get out there and say, seriously, here's what we know, when you have politicians doing that?
It makes it much harder. And politicians have a platform, just like celebrities have a platform. And so you would like to think that they would use that platform to educate and do good, but that's not always true, and it makes it much, much harder. RFK Jr., were he not a Kennedy, wouldn't have a platform. People would just dismiss him as a crank. But he's the son of a very famous man, and so he has a platform that he proceeds to abuse. His family has basically distance themselves from him, but it doesn't matter. He's still Robert F. Kennedy Jr., and he's running for president, and his communications director is Del Bigtree, who's the head of a virulent anti-vaccine group called Informed Consent Action Network. And so it's the anti-vaccine party. And I think in many ways, the right has become kind of this anti-science party. It's all part of this anti-institutionalist backlash against not just the CDC and FDA, but Department of Justice, FBI. I mean, we're just in the midst of overthrowing the federal government.
Let's move on a little bit to a different topic. And this one, there's lots of controversy in the book, so I apologize in advance for hitting you with all this stuff. But you talk about patients, and some of these stories are tragic. Patients that refused to get vaccinated. They needed, some kind of an organ transplant, or they had some pre-existing condition, and some of them died. And there's one anecdote of, I think it's a mother saying, "I just wish my daughter would have got the shot because she'd probably be alive today." Something to that effect. That's really tragic. But you give a couple of stories of patients who were denied care because they refused the vaccine. I'm wondering if you can talk about the ethics of that. Because it seemed there were different hospitals with different policies on that. And was that good? Was that bad? Should it have been more nuanced? What do you think?
Well, the ones I talked about in the book were people who were denied transplants. In other words, they were on a list for a kidney transplant or a heart transplant, which are, often hard to get. And I think people felt that since these are limited, the organs are limited in number, that they didn't want to transplant somebody and then have them get COVID. And they just felt the very least they could do in a matter that was responsible was if you're going to get the transplant, get a vaccine to make sure you put yourself in the safest position possible. I mean, I came away certainly far more sympathetic when I started writing this book than once I finished the book. I just think that there a lot of people don't have access to information. There was an article I talk about in the book where the point was made that those who choose not to get vaccine often don't have a doctor to talk to, and that when they were dying, and this nurse that I talk about in the book was interviewing, they all said the same thing, that they hadn't really talked to anybody. Or early in the pandemic, I don't know if you remember, the CDC said, because hospitals were being overwhelmed, if you're sick, don't go to the emergency department. Don't go to the hospital. Call your doctor. Well, not everybody has a doctor. You know what I'm saying? So there's certain communities that you're ignoring there. Same thing today. I mean, you have people who go to work sick, and we're angry at that because we want them to stay home when they're sick so that they're not transmitting not only COVID, but also the other viruses that can cause people to be hospitalized and die. But health policy or stay-home policies are not great in this country, and some people can't stay home. I mean, there was a story in Philadelphia where a 7-month-old had measles, and we made the diagnosis. It wasn't an easy diagnosis to make because it was a young child, didn't have a typical rash. And when we recognized the diagnosis, we asked the mother to please quarantine that child for the next 21 days, and the next day she sent the child to daycare. Which didn't help. And everybody was really angry at her. But on the other hand, she couldn't stay home. I just don't think we recognize that, how hard it is for some people.
Do you think that some of this is really about retail versus wholesale sales, in the sense that, I spent most of my career as a clinician. And so we had a lot of one-on-one conversations, and that's when the sale of the right treatment for the right person at the right time got made. And there was really no way that I could scale that up. And I'm wondering whether that's part and parcel of how we maybe should change our public health messaging. You see all that stuff about the good results of hypertension management when it's done out of a black barbershop. That when you get to the right people to communicate with on a small scale, you're not going to be affecting hundreds of thousands or thousands of people. When it gets one-on-one, then you seem to be able to make some progress in terms of answering their questions specifically.
That's a great point. I mean, you have to find who people trust and make sure they have the right information. The best example in Philadelphia was an African-American surgeon named Ayla Stanford, who took it upon herself to form something called the Black Doctors COVID Consortium, which she paid for herself, goes into North Philadelphia, a predominantly black and brown community who often don't have doctors they talk to. And she sits in their living rooms one by one, and if they say no, she comes back again. If they say no again, she comes back again. And she's talking to people who look like her, who trust her, and ultimately in a few month period vaccinates 50,000 people in North Philadelphia. Good for her. There should be 1,000 Ayla Stanfords across the country. I mean, she was one of the many points of light, I think, during this pandemic. But I think you're exactly right. Who influences people? How can you identify them and mobilize them?
One other quick academic question, and I promise I'll be quiet once again, which has to do with the question of herd immunity. So early on, they kept giving us numbers. It had to be over 76%. It had to be more than 80%. My rough understanding of biology tells me that it's not a number, it's a dynamic. Is that a fair conclusion to draw, to say that there's really no given, we'd like to have a quantifiable number because then we can say we met it or we didn't meet it. But in reality, that's not how these things work.
Yeah, I think we should have defined what we meant better. So for example, for a long incubation period disease like measles or rubella or mumps or whatever, you can, because all you need is immunological memory to prevent even mild disease, you can eliminate those diseases. So you get to a certain level of immunity, in the case of measles, say 95% immunity, you will stop the spread of that virus, stop the spread of it. You're never going to stop the spread of this virus. I mean, I worked on a rotavirus vaccine for 25 years. That is not a virus, well, all viruses mutate, but it's not a virus that evolves away from recognition by antibodies. So it doesn't create variants, if you will. It's a stable virus, as stable as viruses get. And you probably have 95% immunization rates. We basically eliminated hospitalizations from this country caused by rotavirus because of that vaccine. But the virus still circulates in the community, still causes mild disease. So we have to define what we mean by herd immunity. And by what I mean by herd immunity for this virus is keeping people out of the hospital, out of the intensive care unit, and out of the morgue. And we have to define that because that was clear. I mean, once the vaccine was introduced in 2021, you were 12 times more likely to be hospitalized if you weren't vaccinated. Then as we had more population immunity from natural infection, the following year it was about 6 times more likely. But we needed to define that better because people, very early on, people thought if they got a vaccine that they wouldn't get infected and they wouldn't transmit the virus further, and that's not true. They were less likely to get infected, less likely to transmit, but you didn't eliminate that. You couldn't.
Well, let's end on a more positive note, because these questions are really difficult to answer. So my apologies for that. But you point out in the book, I think the phrase you said is misinformation isn't destiny, and you give the example of older folks, the elderly, who will say they have interesting information sources that they like to rely on. And so you point out that they were exposed typically to much more false information about the vaccines, but nevertheless, their uptake was quite high because they understood the risk that they faced. And that's really encouraging. We've talked about that here before, that people have the capacity when their safety is on the line in many cases, they can evaluate a risk pretty reasonably. And that seems to be what you're saying. So talk about that as we wrap up here.
Well, that, and also that if you're over 65, you're more likely to have health insurance, even through Medicare. And therefore, you're more likely to have an interaction with a healthcare professional, and therefore more likely to be able to ask your question. If you're over 65, you're actually more likely to vote Republican. You're more likely to watch Fox News. So it's not like you're going to be out of the way of misinformation. But I just think that the key there was being able to interact on a fairly routine basis with healthcare, where you could then ask your questions and get them answered for you. And that isn't true of a number of groups in this country who then become vulnerable.
I found it interesting that the at-risk groups responded early in the pandemic to what they're doing. The interesting data, I saw the telephone data showed that the seniors in Florida were already sheltering in place 2 or 3 weeks before the government made any kind of declaration. That once again, you can do an individual assessment, and when everybody around you is getting sick, it's an easy decision to make.
Yeah, let me tell you one story, since I'm actually in Florida, and this is a Florida story. But I think to take a step back, I think the smartest thing you can do right now is, if you're in a high risk group, because that's the goal. The goal of the vaccine: keep you out of the hospital, keep you out of the morgue. So who's getting hospitalized and who's dying? It's really high-risk groups. People over 75, people who have health conditions that put them at risk, chronic lung disease, heart disease, people who are pregnant, and people who are immune compromised. Those are the groups that generally get hospitalized. So if you're in that group and you have respiratory symptoms, test yourself. If you're positive, treat yourself early with an antiviral. If you're not in a high-risk group, don't test yourself. Assume you have COVID or any of these other viruses. And stay home if you can. Stay home if you're sick until you get better. And I like that recent CDC recommendation of when you feel better, you can feel more comfortable about going out. But it's now the immune response is fading, which is to say that viral replication is a much lesser part of pathogenesis of your illness. And extra level of precaution, wear a mask for 5 days if you can. But I like that recommendation. But here's the Florida story. There was I was flying from Florida back to Philly. So I'm waiting in the Florida airport, and there's a man who's maybe in his 50s, and he's vacuuming up and down the aisles. And so everybody's sitting there, and he has a bad cold. Cough, runny nose, sneezing, sort of wiping his runny nose on his sleeve, and he's walking up and down the aisles. And I'm watching it's at Florida, so it's an older group. I'm watching them get progressively more horrified looks on their faces as he's getting closer and closer. And finally, one woman asked the question, surprisingly, was bold enough to say, she said, "Did you test yourself?" It's a hospital employee, an airport employee. "Did you test yourself?" And he proudly says, "Yes, I'm COVID negative," which to him meant I'm good. Right? Even though flu kills 20 to 60,000 people a year, or if among the elderly, RSV kills 10 to 14,000 people a year, or paraflu causes 50,000 hospitalizations. And so we tend to underestimate the importance of these other viruses. Like if you don't have COVID, you're good. But I think we need to rethink that.
That might be the best Florida man story I've ever heard. That's just incredible. It's like a sense of responsibility and then an utter lack of it at the same time. It's just incredible. I love it. I want to encourage people to read this book. We only touched the surface, but if you have questions about anything that's been pandemic related, you really go into it in a very helpful way. I mean, you talk about the different treatments, how the vaccines work, how the FDA authorized them, the licensure process, like everything is covered in great detail. So I learned a lot, and I think people will benefit from this. So again, it's called Tell Me When It's Over, an insider's guide to deciphering COVID myths and navigating our post-pandemic world. Again, you spend more on coffee every day, so just go buy at least a Kindle version of this and read it because you'll benefit. And Paul, before we jump off here, you're on Twitter or X, whatever it is. You're on Substack. Tell people where they can find you and follow your work.
Yeah, I never figure that out. It's like Paul.Offit something, then you get it there. And I do have it at Substack, which if you know how to get on Substack, you can subscribe to my Substack for free. It doesn't cost anything. If you do like Substack Offit, you'll find it. See, I should know these things. My wife knows these things, but it's not hard to find me. Certainly the anti-vaccine people have.
Yeah, they hunt you down in cafes and stuff too. Well, I've got your handle. It's at Dr. Paul Offit on X. And Offit is Offit, if no one is unsure about that. And then Beyond the Noise is the Substack. And again,
that's right. That's what it's called.
It's really good. It's really good stuff. And you were talking about mandates. You talk about everything. It's great. I think you've been a very useful resource throughout the pandemic. So thank you again for joining us. And thank you all for joining us as well. Follow the organization. It's at ACSH.org. I'm at CamJ English. And Chuck's not on social media. He's the smart one of the bunch. So shoot us an email and he'll respond. But we will see you next time. Again, thank you to Dr. Offit. Everyone have a lovely week.